Hello, my name is Lorenza. I'm the student nurse practitioner that'll be doing your assessment today. Is it okay for me to see you?
Yes.
Okay, great. Can you tell me your name, please?
Esmeralda Cruz.
And your date of birth?
January 6, 2000.
Awesome. And can you tell me what year it is?
2017.
Okay, so patient is alert and oriented times 3. Can you tell me if you're taking any medications?
No, just taking vitamins.
Okay, and do you have any allergies to drugs?
Seasonal allergies.
Only seasonal, okay. All right. And do you have any kind of medical conditions?
Just asthma.
Okay. And then do you know your family history?
My mom has prediabetes. I believe my grandma has a heart condition, and my grandpa has diabetes.
Oh, okay. And then are you playing any sports in school?
Yes, I am.
What?
I play softball,
Okay.
so I'm very active.
Great. And are you in any other kind of activities?
After school, yes, I am ASB president. So.
Oh, wow. Okay, that keeps you busy. Who do you live with?
My parents and my sister.
Okay. Have you had any surgeries in the past?
No, I have not.
And do you have you had to have any psychiatric counseling?
No.
Okay, perfect. All right, so I'm going to go ahead and start the assessment. I'm going to go head to toe. We're going to have different position changes throughout the exam. If at any point you feel uncomfortable or pain, let me know.
Okay.
Okay? And I'll be asking certain questions as I'm going through each system.
Okay.
Perfect. So the patient appears to be, after we've secured patient confidentiality and I have practiced hand hygiene, we are now going to assess the patient visually, and she does look well groomed, she looks well nourished, and mood and affect are appropriate. Okay. Now we're going to start with the skin. It is warm and it is pink. Okay, no acne, no lesions, no scars. I'm gonna go ahead and just have you turn sideways. Perfect. Okay, and then have you had any issues with your hair lately?
No.
Okay, no thinning of the hair?
No.
Okay. Okay, awesome. So the hair is distributed evenly. We've got nice thick texture to it and no dryness of the scalp. Okay. Alright. And the face is symmetrical. She's got a normal cephalic head. It's smooth, has uniform consistency with no presence of nodules or masses. Okay. And we're inspecting the ears. Okay, the external ear appears to be normal. We have no swelling. Okay, no discharge. Okay, and we're going to inspect the eyes. So the eyelids are symmetrical, and we have no swelling, no discharge. Conjunctiva is nice and pink. Sclera is nice and white. We're inspecting the nose, and we don't have any discharge. Nares are symmetrical. Okay, no deviated septum. Now we're looking at the buccal and lips. Everything looks nice, moist, and pink. Okay, and now we're going to inspect the TM for TMJ. Can you open and close? Close. Perfect. TMJ is in place. No dislocation palpated. Okay. All right. So I'm gonna go ahead and check your ears. Have you had any issues with your ears lately?
No.
Any discharge?
Mm-mm.
Any pain?
No.
Okay. So. Okay, so the ear canal looks fine. No erythema, no discharge, no swelling. Temporal membrane is nice and pearly gray, intact. Okay, and I'm going to do a little hearing, a whisper test, okay? So I'm going to whisper something and I want you to repeat it.
99.
99.
99.
Okay. Palpating the mastoid. Okay. Perfect. So now we're going to inspect the nose and the sinuses. Can you go ahead up for me? Okay, nerves are symmetrical. No discharge. No erythema to the area. Okay, I'm going to check for patency. Can you go ahead and close one nostril and the next? Okay, complete patency to both nostrils. Nasal septum is straight, no deviation of the septum. Let's see. So we're going to palpate the sinuses. Let me know if you feel any tenderness. Frontal sinus. Okay. Ethmoid sinus. Let me have you just turn a little bit. Frontal sinus, ethmoid sinus, and the maxillary sinus. Any tenderness at all?
No.
Have you had any runny nose lately?
No.
Okay. Have you ever had any issues with your sinuses in the past?
No.
Okay. Now I'm going to inspect your mouth. If you can go ahead and open for me. Okay, oral mucosa is nice, moist, and pink. No lesions. Can you say for me? Okay. And can you move your tongue to one side? And then move it to the other side. Okay, you can go ahead and put it down. Okay, so that was... okay, and then I want you to go ahead and follow my finger. Okay, with your eyes only. Ready? Okay, and that was testing cranial nerve 3, 4, and 6 with the 6 cardinals of gaze. And we had no nystagmus. Now I want you to look straight at me, and I'm going to check your pupillary reflex. Okay, we got perla to both eyes. Okay. Now I'm going to go ahead and inspect the neck. Okay. Cervical lymph nodes are non-palpable. Tonsils are non-palpable. Trachea is midline. And we've got no JVD distension. Okay, I'm going to switch from the back. Can you go ahead and swallow for me? Go ahead and swallow. Okay, so no goiters palpated. Okay, and I'm just going to have you turn this way a little bit. Okay, that's perfect. I want to make sure we are looking at the camera here. Okay, so now any issues with your smell?
No.
Okay, so that we know the olfactory nerve, which is cranial nerve 1, is intact. And we have tested the cranial nerve 2 with the visual acuity. Snellen test was 20/20. And I'm going to check the fundus of the eye. Okay. So we've got the red reflex. And I'm going to come very close, okay? let me know if you feel. And just try not to blink so much if possible. Okay. Awesome. Have you had any problems? Do you wear any glasses?
No.
Okay. And you've never had any issues with your vision?
No.
Okay. So we have inspected the fundus, and we've got the cornea is transparent, smooth, shiny, and the iris details are visible. We had a little bit of blinking, but the cornea was touched. That's why she blinked. So, okay. Now we're going to be testing cranial nerve 5, which is the sensation of the skin. Let me grab my tool here. Okay, and we're going to pretend that this is a soft cotton. Okay, and let me know when you have you feel it. Yes.
Yeah. Yes. 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 Yes.
Okay. And we've got blinking. Okay, when the eyelashes are touched. Okay. And cranial nerve 7, we know is just fine. We've got the tongue, stick it out, move it side to side. Okay, so cranial nerve 7 is intact. We're doing cranial nerve 8 now, and that's by doing the Weber and the Renee test. Okay, so first one is I'm going to be touching this. It's going to make a ringing sound, and I'm going to put it on the top of your head, and you tell me if you hear it or not, and on what side do you hear it.
On the right side.
Here on there.
No. Yes.
Is it even on both sides?
Yes.
Awesome. Okay. And now we're going to be doing the air conduction versus bone conduction, and I want you to tell me when you stop hearing it here, and then when you stop hearing it here. Okay.
Stopped. Stopped.
Okay, so that's normal. We've got air conduction more than bone conduction, and that was for cranial nerve 8. Okay, and we've got cranial nerve 9, the glossopharyngeal. Go ahead and stick your tongue out. We're going to test the gag reflex. Okay, so we've got the gag reflex. So that is the vagus nerve, and we've got the trapezius muscle. I want you to go ahead and push up with your shoulders. Okay, and that's intact as well. Okay, and we did do the cranial nerve 12 when we assessed the movement of the tongue side to side. Now we're going to go ahead and move on to inspecting the lungs and the chest. Okay. So we've inspected, and we're going to pretend that the patient has her shirt off, and we are auscultating directly onto the skin. So everything, chest is symmetrical. If you have any issues breathing, you did say you have some asthma, but it only happens rarely.
Yes.
Okay. So chest is symmetrical, no barrel chest, it's nice and flat. Okay, we're going to go ahead and listen to the lungs. Deep breath in and out. In and out.